Hello, I'm Dr. Wickham Simonds, and this is Obesity Medicine Perspective. I'm an obesity medicine specialist in the Triangle area of North Carolina, and you can watch this from anywhere in the country, and you'll learn about obesity. So, on the previous two videos, I talked about the role of exercise in your weight loss efforts and weight maintenance. I talked about the role of what's called NEAT, or non-exercise activity thermogenesis, and how that helps you lose weight. And so if you haven't watched those videos, go back and watch them. You'll learn some cool stuff, and the videos aren't long, and I hit the take-home points pretty effectively, and you learn what you need to know in a short period of time. Today I just want to talk about the general subject of obesity medicine. I kind of talked about that back at the beginning. So I am an obesity medicine specialist. You say, well, what is an obesity medicine specialist? So most of you are familiar with the idea of a family practice doctor, an internal medicine doctor, a general surgeon, a pediatrician, an emergency room doctor, and those doctors all have their own training programs, and they have boards that they get certified in that specialty through, and that has been a long-standing process in this country. And most of you have had contact with someone who's board certified in one of those specialties. What is fairly new and what most people, most doctors don't understand, and what the general public in most cases does not understand, is that obesity medicine is a new specialty, and there is a board certification, and you can become an obesity medicine specialist. So my primary training is in emergency medicine, and I also am board certified in obesity medicine. And so the training is excellent in obesity medicine, and this is a new and rapidly evolving field, and we need more doctors and specialists. We need a lot more. We need a lot more. 250 million Americans are overweight or obese. This is a national health crisis, and we need more people trained to treat this disease. Obesity is a chronic, relapsing disease, and its results are really disastrous on the nation's health. So if you're a physician out there and you watch this and you don't, or a patient, and you want to suggest this to your physician, hey, would you consider getting board certified in obesity medicine? The process is not as difficult as you think, and you are welcome to call our office here in Raleigh or Durham. Our number's on our website, and I can guide you through that process and help you get moving in that direction, and that would be an excellent thing. I want to draw attention also to the Obesity Medicine Association. So the Obesity Medicine Association is a group of obesity medicine specialists from across the country, and providers who maybe aren't doctors but who practice obesity medicine in some form, like registered dietitians, family nurse practitioners, PAs, and so forth, and registered nurses. And the Obesity Medicine Association is the main group of clinicians that are in this specialty. There really is no other group. They provide outstanding continuing medical education. Their conferences and education are absolutely fantastic, and it's a great opportunity to network with other providers from around the country who are practicing in this field and having success, and you can learn from those people and get to know them, and it enhances your own practice. So here at Dr. Simonds Weight Loss, I'm very active in that association, and myself and my staff, and we attend those meetings, and we do the continuing medical education, and we stay up to date on the most cutting-edge stuff. We are also supporters of the research arm of that organization called the Obesity Treatment Foundation. And some of you who know me realize I'm growing this mop of hair up on my head. I'm a short hair kind of guy, but to raise money for the Obesity Treatment Foundation, I took a hair growth challenge back in April of 2015, and it's going to go all the way to April of 2016. And I'm going to grow my hair, and people are sponsoring me, some people even at $100 an inch. And so the idea is my hair will be measured in April of 2016 at a conference where the foundation is having a fundraiser, and then people will actually pay by the inch. The money goes to the foundation. It's a nonprofit foundation that educates the public and providers about the disease of obesity, and it sponsors obesity research. We need a lot more of that. and there's just not enough public monies to go around. So the idea is we raise private money, we sponsor research, and clinicians like me learn from that research. We learn new techniques by it. And so that gives you a little background on obesity medicine and what that is, the Obesity Medicine Association and how that helps providers be better, and the Obesity Treatment Foundation, which sponsors research and which sponsors education programs to educate the general public and physicians about the disease of obesity.